Well, welcome back. We're continuing to spotlight local nonprofits in the area as this COVID-19 situation makes it more and more difficult for them to serve the people that they normally serve. So joining us now, thanks to Dakota Medical Foundation, is Eric Munson with Lutheran Social Services. Eric, welcome to the show. It's great to have you with us. I know these are some very challenging times. So for people maybe out there that aren't familiar with Lutheran Social Services, help them understand, what do you guys do?
Okay. Well, thank you, Chris. Appreciate the opportunity. LSS North Dakota offers a variety of services for both children and family, preteens, teens, young adults, all the way through senior years.
And so how is the COVID-19 situation, it seems to be impacting everybody obviously a little bit differently. So how is it impacting your guys' services, and how does it make it more challenging?
Well, many of our services are face-to-face, person-to-person, home visiting, and groups. Gambler's Choice, as an example, is a program for people with gambling addictions, and that generally is delivered through group meetings of 10 to 15 people. So we've been unable to do that. We have, however, changed the way we do things. We're staying in touch with people, sometimes via Zoom, Teams, direct phone contact, and even have set up some smaller groups. Same thing with our mental health counseling. We transitioned to telehealth services as fast as possible. A lot of cooperation from the state of North Dakota in order to do that. In some of our senior program areas, we are not currently being paid because of the way that services need to be delivered in the home, face-to-face. But nonetheless, we have kept staff on in order to make contacts on a daily basis with individuals to make sure that they're okay and getting any other services that they might need.
You know, Eric, one of the things that we don't maybe talk enough about is how is for example, the telemedicine or things of that nature, are you still seeing it's having the same kind of impact on your clients? Are they suffering from this as well, or?
Well, I think we've had an uptick in interest in the program or demand for the programs, and we continue to deliver telehealth for those that are comfortable with it or have the capability to do that. And I think that can work well. Sometimes with youngsters, however, we can't deliver the same type of service. It's more difficult to keep child's attention, as an example, over a video link. So many of us have that issue, maybe, perhaps, Chris, but so we aren't able to deliver some of the services that we would otherwise be delivering.
So one of the great things that Dakota Medical Foundation is allowing us to do is give you guys a platform and really give you a chance to ask our community, what can we do to serve you? So give us some suggestions, please.
Well, I think visiting our website, lssnd.org, or if you would like to inquire as to some services, or you think you need some help in one way or the other, please call us at 701-235-1510. And you can either contact us through the website or through that phone number, and we'll make sure that you get whatever assistance that you might need during this obviously very unusual and sometimes strange times that we live in.
Boy, you said it well there. So we got about 60 seconds left, Eric. Anything else you want our audience to know?
Well, I just want to thank Dakota Medical Foundation and Bremer Foundation is providing support to nonprofits. Grand Forks Community Foundation, we're a statewide organization, so we deliver border to border, north to south, east to west. And we have worked with many fine people around the state that help us. We have public health nurses that are working with us in terms of our plans, as well as a couple of epidemiologists that advise us in terms of our offices and our services. So we appreciate that. And thanks to you to be able to highlight some of the needs of nonprofits during this time.
Yeah, I think it's so important. So as you said, thank you to Dakota Medical Foundation. And thanks for joining us this morning, Eric. We appreciate the insight, and good luck as we all sort of navigate through this thing, okay?
Well, thank you very much.
Thank you very much as well.
Appreciate
And
it.
stay with us. We got a lot more coming up right here on North Dakota Today.